This fall, Lehigh Valley Hospital Hazleton was reaccredited as a Level 4 trauma center. That was done by the Pennsylvania Trauma Systems Foundation, which is a nonprofit organization. Today, I am pleased to be joined by Dr. Kira Weaver. She is the Trauma Program Medical Director, and also Dennis Gans, and Dennis is Director of Pre-Hospital EMS. Thank you both for being here with me today. Dr. Weaver, I'm going to start with you. What does this Level 4 reaccreditation mean, especially for us, the people of the greater Hazleton area?
So the reaccreditation actually is a great thing for our community. Being part of this program, although it is very rigorous, allows us to have patients with traumatic injuries be brought to our hospital and stabilized. We do offer ortho services here, and some patients are able to be admitted. However, it also allows us to take higher acuity trauma patients and stabilize them instead of having to go to a farther level facility first. So it enables us to bring in some additional resources, be part of a program and their standards, and provide better patient care to our community.
Now, when we talk about trauma, what exactly is trauma? Because many things come to my mind, but I'm not sure if I'm correct in what I'm thinking.
So trauma is a very broad category for basically conditions caused by injury. So it could be anything from a twisted ankle or a broken ankle. It can be anything from a head bleed. It could be anything involving like chest trauma, like a collapsed lung. So it's very broad. It's complicated. It's actually some of the hardest, most difficult patients that we care for in the emergency department, because a lot of the patients have underlying medical conditions. Sometimes we have to have special considerations with anticoagulation, pediatrics, geriatrics, pregnant patients. So all those things come into play with trauma, which makes it a little bit more difficult than other medical conditions to care for. It's, very interesting, from a provider standpoint, but it is a challenge, and it's a great thing to be able to care for in Hazleton.
Very good. Now, Dennis, you're on the EMS side of this. So how does this designation as Level 4 trauma help your job?
It's a tremendous help and a benefit to us and the community. As Dr. Weaver said, it allows our community to know that they can come to Lehigh Valley Hospital Hazleton and be cared for and treated and or stabilized before we would have to move them. On the EMS side, what it allows us and our partners in the community, on the EMS, family and so forth, to stay as available as we possibly can. So instead of having to drive a half hour, 45 minutes to an accredited trauma center, we have one right here in Hazleton. We can take those patients immediately to a very close hospital with short response times to the hospital. We give our report as we're coming in, and the trauma team is waiting for us as we come through the emergency department doors, right into the trauma bay, which is right inside there. We're able to give our report, transfer care over, and then an ambulance is then back available to respond to another emergency need. So it really is a benefit for the community to have EMS services available very quickly and not having them out of the area depleting services when we know how difficult times are right now for EMS providers.
Now, Dr. Weaver, do you see a high percentage of cases of trauma in Lehigh Valley Hazleton?
So we do see a substantial amount of trauma. I don't have a percentage offhand, but for example, for our higher acuity trauma patients that are alerts in our system, we see about 100 patients a month that meet our criteria that we have set for trauma.
And who is the person that actually determines that it is a trauma? Is that something done out in the field, like when EMS is bringing them in, or is that something when they get to the hospital that's determined?
So it's a team effort. So when patients meet our trauma alert criteria, it can be called by our pre-hospital colleagues. It can also be called by our nursing staff if they recognize that the patient meets our criteria to be a trauma alert, or by any of our providers, physicians, nurse practitioners, PAs.
Well, this is great. I know you've had that designation before, but this now keeps it going for the area. So it means quicker care, I would think, is the bottom line for people watching this today.
You're correct. Trauma is time sensitive, kind of along the lines of like stroke and MI, that minutes do matter. So that's why it's very important to be able to be a part of this program and be able to stabilize those patients that need that care most critically and quickly.
Well, Well, thank you to both of you for explaining this to us and letting us have a better understanding of what it means. And we hope that you continue to do the good work that you do in our area. Thank you both for joining me today.
Thank you.
Thank you.